Hi, everyone. Thank you so much for joining us today for our kickoff of our Business Health Connect series with Dr. Mansfield. We are on Zoom today only, so we're going to give everyone just a minute or two to log in to make sure they don't have any technology issues or problems logging in. So we'll get started in just about a minute or two. So thank you for your patience. For all of you who are tuned in via video while we're waiting for the rest of our attendees to join us today. We do have a few housekeeping things we'll quickly go over. I know at this point in the COVID-19 pandemic, almost everyone is familiar with Zoom, but we do have your cameras and microphones muted except for our panelists and our host today. Even though you are muted, we definitely want to keep you guys engaged in our conversation with Dr. Mansfield. So please feel free to submit any questions you have in the chat or Q&A feature, which you can see in the bottom toolbar of your screen. You can submit them either way. We'll be monitoring those, and we'll do our best to get those questions answered for you in the time that we have today with Dr. Mansfield. Okay, so I see we have a few of our attendees on, so I'm going to go ahead and we'll get started. So thanks again for joining us for our first Business Health Connect series. I'm Lane Galata. I'll be your moderator for today, so I'll help Dr. Mansfield field questions at the end of the event. I'll give you all a little brief background about Dr. Mansfield, and then I'll hand it over and let her tell you some things about herself as well. Dr. Mansfield is a diplomat and a fellow with the American Board of Preventive Medicine in Occupational and Environmental Medicine. She also holds a certification as a medical review officer, and we are thrilled to welcome her to Kelsey-Seybold. She's new to Kelsey-Seybold, and she holds the position of Medical Director of Occupational Medicine here at Kelsey. So Dr. Mansfield, thank you so much for joining us. Do you want to give us a little bit of background about your education and prior experience and what you do as the Medical Director for Occupational Medicine here at Kelsey?
Sure. Thank you, Lane, for that lovely introduction. Good afternoon, everyone, and welcome to Kelsey-Seybold Clinic's webinar series. I'm glad you're with us this afternoon. As Lane stated, I am the Occupational Medical Director for Kelsey-Seybold Clinic, and I have been in the field of occupational medicine for about 15 years and have worked in a variety of settings from clinical to petrochemical. So I have a wealth of experience. I've also had some experience in public health, working directly with COVID patients. And so, you know, this is kind of the new norm now, which brings us here to talk about COVID. And so I hope today to give you a little bit more guidance on how to safely return your employees back to work. I know many of you have already returned back to work, and you may have, you know, at least some staffing at your workplace, but I want to give you some strategies that may further help you, as well as some coping strategies that will further help you through this difficult time. Okay, ready to get started, Lane?
Yes, you're good to go.
Okay, thank you. So as I stated, I wanted to kind of give you a little bit more information about what is an exposure. I often get questions about what is an exposure, and also preparing your workplace. What do you need to prepare your workplace? And give you some tips on wellness and how to be more resilient. So a COVID exposure is one in which an individual is exposed to someone who either is confirmed, which is a positive test, or suspected of COVID, someone who may have symptoms within 6 feet and greater than 15 minutes, okay? And this means that this could be with or without a mask. It's still considered an exposure. And it's generally about 48 hours before that contact. So let's talk about occupational exposures, because I know that's what you're concerned about in your workplaces, okay? So OSHA did a really good job at dividing job tasks based on risk levels. So we have very high risk to low risk. And most of your workplaces will fall into the lower risk or medium risk. Generally, the high risk category is for workers who work in very technical healthcare settings, so specific medical procedures that are high risk or laboratory work. And high risk would be your general medical settings, hospital staff experiences high risk. And then of course, medium and lower, the difference between those two is that the lower risk category, there's not a lot of expected interaction with the public or with other people, meaning that you can go into your office, shut the door, and you don't have to be exposed to anyone else. There's not a lot of interaction with the public. So this is a really nice chart of what is considered low risk to high risk. And some of these activities, I think they're just point on. And it ranges anywhere from 1 being the lowest risk to 9 being the highest risk. So you can see one of the questions that I always get is, should I take my kids to school? And so if you make that decision, you really have to weigh the risks. So you have, if you look at category number 5, that's kind of where we are with sending your children to school. But if you also look in the same range, the decision to go to work is also a 5. So if you decide to go to an office and work for a week, it's pretty much a similar risk as you taking your kids to school. So this is a really good measure of some of the activities that you may do. Notice that, you know, going to a restaurant and eating indoors is higher risk, but if you're eating outdoors on a patio, it's lower risk. And then of course, some of the highest risk exposures, you really want to avoid those. And you can see the highest risk is actually going to a bar. So when considering preparing your workplace for your workers to come back, whether it be part-time, whether it be a few people versus the whole entire staff, you want to have certain things in place. And importantly, you really need to have an infectious disease preparedness and response plan, minimally, on how you deal with exposures. And also a reopening plan, I think, is very valuable. And knowing how are you going to respond to local guidance. The local guidance does change. I think it's really important to understand what that local guidance is, whether reopening is at 25% versus 50% rather. So I think you should definitely stay tuned to that guidance. And also looking at the jobs in your workplace and evaluating what is the risk in those jobs. So if you have, just say if you're a meat packing plant, you have lots of workers, they're in close proximity. So how do you keep those people away from each other? So there's a lot that goes into planning reopening your workplace. And also, if you do get exposure, how are you going to disinfect and implement prevention measures? Are you going to close down your workplace for 24 hours if you have an exposure? How are you going to manage close contacts? How are you going to manage sick people? How many days are you going to keep them out? And one of the things I think is often missed is having policies in place prior to reopening so that your employees will know, if I get sick, if I have to be out of work, what are the policies around vacation time, sick pay, leave policies, because some companies will ensure that before they bring their workers back to work that they have a negative test. If that's the case, oftentimes it could be weeks before someone has a negative test. Some may be positive for up to 3 to 4 weeks, which means that you need to consider that when developing your sick leave policies. So this is one of my favorite infographics here, and this is adapted from NIOSH. It's a hierarchy of controls, and this is often used when looking at risks. So as you can see, the most effective way to mitigate risk is elimination, okay? Elimination, in this case, would be everybody stay at home. As you can see, that's not sustainable long-term. So that would be the most effective way to mitigate COVID. And of course, substitution doesn't apply to us. And then you have your engineering controls, administrative controls, and then PPE, which is the least effective. And I will talk about those a little bit more detail. So in mitigating and controlling COVID-19, it's going to take a multi-layered strategy. You're going to have to utilize engineering controls, administrative controls, as well as PPE. There's a lot of things that go into this decision-making process when you're trying to make your workplace safe. And so for engineering controls, one of the things that I think is very effective, and I've seen this pretty much everywhere, no matter where you go, whether it's the bank, the supermarket, you're going to see physical barriers, and more than likely it's plexiglass. Because plexiglass is very effective at stopping particles in infecting other people. It's very advantageous because it's cheap, it's transparent, it's easily cleanable. There is another material, tempered glass and polycarbonate. Those are a little bit more expensive, but they are more durable depending on what kind of workspace you have. Other considerations when you're talking about putting any type of barrier such as plexiglass, you want to make sure that you have your facilities team look at the ventilation system and how will the plexiglass impact that. I've seen clients say, okay, well, I want to put the plexiglass all the way up to the ceiling. Well, that's not the best idea because you're going to interfere with the ventilation system, with the airflow, especially if you have fresh air coming in. You know, airflow is very, very important. You want to make sure that your airflow is very strategic. So your air is not coming in and you're recirculating virus particles. So when you're looking to put in plexiglass, you want to make sure that it's roughly about 72 inches or 6 feet above the floor to account for the tallest person if they're standing, just say if you have it on a cubicle type of instance. And you want to make sure that you're looking at airflow in terms of doors being opened, etc. So ventilation is a really complicated topic that you probably are hearing a lot about. ASHRAE has put out a lot of guidance on ventilation. School systems are looking at their ventilation system when they're deciding when to reopen. You have to take ventilation into consideration, and you need, engineers, facilities people to really look at your ventilation system and do an audit to look at, how much fresh air or outdoor air you have coming in. It's really important to make sure that the humidity is low. So in Houston, we have high humidity, so you can't have too much outdoor air coming in because of the humidity. You want to keep it less than 40%. And then ASHRAE recommends that you have a maximum of 65% of outdoor air coming in because you're also bringing in everything that's outdoors. So then you cause more problems. And then, diluting the air with repeated air exchanges. About 10 per hour is a good number because it offers about 99% reduction in particles. And then you want to reduce recirculating the air because if the air is contaminated, which if you have people in your workplace, you have a constant potential threat and it's constantly there. So you don't want to keep recirculating the air around. And running fans, I think, is good. Not the ceiling fans. This is more the air conditioning type unit fans that helps to remove some of the particles. And then when you're talking about filtration, HVAC systems, these are really complicated. So, I never guide a client to say, oh, just pop in a MERV 13 filter rating system because a MERV 13 may not operate in your current ventilation system. So typically, let's say in the average building in Houston, You know, some of these buildings are older, they have MERV ratings of 8 or 9, 10, and those are fairly low, and they're not going to remove majority of the virus particles. 13 is much better to capture those particles, but your system may have to be upgraded and it may need to be changed. So those are some of the things that your facilities people can look at. And HEPA filters, same thing. You know, HEPA filters are great. They're better than a MERV 16, but they can create problems. They can create pressure drops in your system and airflow imbalances. And we've seen contamination just in restaurants. You know, restaurants that have had, they feel that they have great circulation, but the air is just recirculating, and it's, you know, other people in the restaurant are getting infected. And let's talk about the portable air cleaners. I think they're great. However, it's difficult to utilize these in a large environment. These are meant for small rooms, small settings, and they're really good at reducing aerosols. So air germicidal UV light. This has been something that has been used with TB for years. It's been shown to be effective. We don't know the effectiveness with COVID. We just don't have enough history. And there's a lot of emerging research in this area. And I see this as something that could be very positive, but we'll know, you know, in time. Of course, there's some safety concerns with UV light. It's costly, and it really should be used within a ventilation system. So the other ways to control COVID-19, and like I said, this is a multi-layered approach, is to use administrative methods, which is really changing the way the workers do things. So you're changing kind of the behaviors of people. And so this is just encouraging people, when you're sick, do not go to work, stay home. You want to make sure that you're minimizing workers from face-to-face meetings. You want to do as much virtual as possible. You know, I would not have people, you know, sitting at the lunch counter the lunch table, having Bible study at work. I know it's something that people want to do, but it's just very, I think it's just too risky. So trying to monitor how workers interface with each other, I think is very important. Also, alternating shifts or alternating days, bringing in, you know, 40% of the workplace on Mondays and Tuesdays, and then bringing more of the workforce in on Thursdays and Fridays. There's just ways to do it that, you know, you have to look and see what makes most sense for your workplace. In addition, travel. Many companies are not traveling at this point. They have just pretty much ended non-essential travel. You know, airplanes have been made safer. They're doing a lot of things to make it safe for air travel, but I wouldn't recommend if it's non-essential, and I would always follow the CDC guidance. And of course, screening. Most places that you enter nowadays have some type of screening, whether it be asking questions, if they've had COVID symptoms, or taking their temperature. And of course, physical distancing in elevators, conference rooms, putting signage on your doors and on chairs so that people don't sit in certain places. And then of course, cleaning and disinfection. So when you're considering cleaning and disinfecting your plexiglass or polycarbonate material barriers, you want to make sure you're using the right cleaning products. Some of these cleaning products are not meant for that type of material, so be cautious with that. And then of course, PPE. We're all wearing masks, so at least we're all supposed to be wearing masks. PPE is the least effective, but masks are very beneficial at reducing the spread of the virus. And masks need to be properly fitted. They need to be inspected and cared for. It's no good to wear a mask that's soiled and dirty. Make sure that you store your mask properly. And there's all sorts of masks. There's N95s, which we reserve for the healthcare setting. And now more popularly is the KN95, which many people wear. You don't need to be fit tested for those. However, there are some bogus products out there. So just make sure you know where your product is coming from. And then of course, your facial coverings. So what is a good mask? A good mask is one that is worn regularly and it doesn't interfere with activities. I was at the phone store and the guy had the mask over his nose, but not over his mouth. So that just wasn't, very good and not effective. So you want to make sure that the mask fits properly over your nose and your mouth. 3 layers are best. The gaiters that people wear, I'm not sure about those. If it has multiple layers, that's okay. Or if you have a mask underneath it, that's okay. But there's many places that won't even allow you to wear gaiter masks, as well as the mask with the exhalation valve. Those are also not very effective. Face shields do not replace masks. I like face shields, especially if I'm flying. It offers some eye protection. We use those in the healthcare setting. It just adds, a little bit extra protection against, the spread of particles. It can be very helpful for some. It's very inexpensive and easy to acquire. So let's kind of shift into dealing with COVID. I think now we have adapted to a new way of life. I think most of us are starting to really adapt and to learn how to deal with the stress that has come with COVID-19. I think it's very important that we continue to do things that make us resilient. I know we're tempted to sit and watch the news all day or evening, but sometimes we need to take a break from it. I think it helps to do some reading, to catch up on maybe some hobbies that you've always wanted to do. Social media is one of the things too, can get, a little dicey with some of the things that you're reading and some of the rumors and unreliable facts. So just be cautious on what you're reading. Keep yourself in the best shape possible. I know many of us gained 15, 20 pounds in the beginning of COVID because we were everything was out of control. Nobody knew what was going on. And we tended to kind of lean to things that maybe some unhealthy behaviors. But I think now we're starting to shift back into, how do we regroup and focus on ourselves, our bodies, and being healthy. So sleeping well, eating healthy, and being physically active is very important. So we continue on into the pandemic, into the fall. And more than likely, we will see a second peak, which many places have already experienced or experiencing. And with the colder months, there is the risk of just feeling more cooped up and restless because during the summer, we were able to be outside and do things. So we need to be cautious of that as we go into the winter months. Maybe your relationships are strained. Maybe those are some of the things you should focus on in terms of building your relationships with your family members. And some people feel very isolated and lonely. And, there's a way to deal with some of these issues. Many companies have EAP and mental health assistance, which I encourage you to take advantage of. Because it's a scary time, especially if you have loved ones who are ill, or if you're worrying about your loved ones who may get ill. that can cause a lot of stress. And of course, the remote learning. I know many of us have dealt with remote learning and helping children adjust. It's not just us adjusting, it's the children. And so trying to keep them preoccupied, trying to manage a full-time job and your child's work schedule, it's a balancing act. It can be very challenging. And I have dealt with it myself. Fortunately, my children are back in school, but that was one of the decisions I had to weigh, the risk and what's going to be best for their mental health. And so far, so good. Haven't had any issues. So if you're feeling stressed or anxious, uncertain about things, I think a lot of us are uncertain. We don't know when the vaccine is coming. We hear it's coming soon. Nobody really knows. And your feelings are valid and they're normal, healthy responses. And so if you're able to recognize that you have these feelings, I think it's better to actually deal with them, because we all process stress in different ways. I encourage you to lean on your support systems, your friends. You know, there may be relationships that you hadn't had in years. You know, there may be friends from high school. I had a friend from high school called me yesterday out of the blue. It was just such a great thing, you know, to maybe rekindle some of those relationships and build on your support system. I think it'd be very, very helpful. And of course, hobbies. This is one of my favorite things is, you know, what new hobbies can you do? I know I've picked up on many different things that I've always wanted to do or just didn't have time to do. And not that we have more time now, because we all feel like we're working more now during this pandemic. We're working differently, but we're working more, we're doing more. But it does allow you to do some other things as well, because we don't have the hustle and bustle that we're used to. So think about some of the hobbies and things you want to do during this time. And then mindfulness. You know, mindfulness is one of those things you hear about all the time, but it really does work. It's really just focusing on what your purpose is and just really honing in on your senses. How are you feeling? What are your thoughts? What are your emotions? And, you know, listening to your breath. It really helps you to respond differently because you're more present. And there are lots of mindfulness books out there, lots of resources. But you don't have to make it complicated. It's very simple. It could be hard for some because it's hard to sometimes quiet your mind, but if you keep practicing, it does get easier. And then meditation. Meditation is, it could be you're sitting at your desk and you're just, you know, taking deep breaths. It could be informal. It could even be brushing your teeth. When you brush your teeth in the morning, you know, thinking positive thoughts, you know, thinking about the things that you're grateful for. That is considered meditation. It's considered informal meditation. And then you can do formal meditation, which is more about being mindful, and you're sitting there and you're trying to engage in the actual practice of the breathing. And even through yoga, is a good way to incorporate meditation. And as I said before, ask for help if you need it. There are plenty of resources out there. You just have to discover what it is that you need and seek it out. And then what other things can you do? As we close this webinar, I want to encourage you to embrace learning and grow from this. How can we be better from the situation? How do we help others? We need to lean back, help other people, because we are far better than many out there. And how can we rebuild our communities? We want to exercise responsibility of taking care of ourselves and taking care of our families and our environments around us. And of course, be creative, and use humor. This slide, I found it to be kind of interesting because back in, I would say early March, I think many of us were in the fear zone. My husband went out and hoarded, paper towels and toilet paper and food, and nobody knew what was going on. And it was scary. And I feel that we kind of moved into the learning zone as time went on. Around April and May, we stopped, having to go out and procure lots of food and items. We learned more about the virus. And so now I feel that we are in a growth zone. And this is the zone where we're able to find our purpose. And as I said, use your skills to help other people. And I just want to say one thing about the flu vaccine before we wrap up. It is flu season. I think it's very important for you to continue to push your vaccine campaigns because having flu and COVID at the same time, nobody knows what that really looks like, but it would more than likely impact our healthcare system. Having the two together can cause more serious illness. And so I feel that it's important to make sure that we vaccinate our populations that are most risk, our children, elderly, and pretty much anyone. And here are some resources. And now it's time for question and answer.
Thank you, Dr. Mansfield. We're going to start our question and answer session now. So all of you who are still tuned in, if you have any questions you'd like Dr. Mansfield to answer, you can submit them to the chat section or the Q&A section at the bottom of your Zoom screen. We have about 15 minutes left with Dr. Mansfield, so we will go ahead and use this time for Q&As before we wrap up today. Dr. Mansfield, one of the things that came up during your presentation was you talked a lot about resources, and you definitely give some great resources for employers to help their employees through EAP programs and things like that. What resources would you suggest for employers who are looking to develop a plan for maybe employees who tested positive and are now returning to the workforce? Do you have any guidance or resources you can share on that topic?
Sure. CDC is always a great resource. If you have employees that test positive, you're going to want to do contact tracing, and many companies have opted to do contact tracing internally because it's much more effective, it's quicker. You do have to notify the health departments, but sometimes due to the numbers and if the community numbers are high, it may be difficult to engage them in that process. And so CDC has pretty much an abundance of resources on how to contact trace. And of course, Kelsey-Seybold, we are always here to help. We have been doing a lot of work with COVID, with testing. We are now doing asymptomatic testing, and we have an abundance of resources to help corporations with any of their needs.
So let's hop over and talk about fall. We know we have tons of illnesses that pop up in the fall, from colds to flus, allergies. Let's talk about the resurgence in COVID. Are we still expecting there to be a fall wave or a fall resurgence through the cold and flu season? Or do we think maybe because people have been exposed for such a long time now that maybe it won't be as bad as we thought was once to be expected?
No one really knows, but just from previous numbers and that I've seen, I think that is expected to go up because there will be less people outdoors, more people indoors. CDC just came out with an article that COVID is airborne. I think we already suspected that. So I anticipate the numbers are going to go higher. As you see in New York, they were expected to go back to school, but they are actually withdrawing that decision because the community numbers are going up in New York. So we saw that New York had high numbers originally, and their numbers went down. So that could be an indication that our numbers here in Texas could be going up, and as well as other places. As people get laxed, people get tired. Some people are not consistent with wearing their mask. So I anticipate that the numbers will probably go up.
Let's talk about COVID treatments. Do we have any updates with any medications, treatment regimens, or anything found, any new research or articles about treating COVID?
So everything is experimental. As you have probably seen on the news, President Trump did get a series of cocktails, COVID cocktails, which more than likely is the antibody cocktail. Convalescent antibody is something that after you have had COVID, they are asking that individuals donate their plasma to help with treatment. So that's one of the things that I think is very promising. Remdesivir is also very promising. There's nothing that has been proven. However, they're promising and they're still studying these treatments.
Next question that came in is about testing. Can you discuss the different testing methods for COVID-19 that are available at Kelsey? And do we know whether or not certain testing methods are covered by insurance or not?
Sure. Many of them now are covered by insurance, which is a good thing. There are two types of tests for COVID. There's the PCR test, which is the gold standard. That's the test that comes back in 1 to 3 days. Kelsey does offer that. And testing, that's the standard nasal swab. We call it swab and go. You just pull up, and it's a very fast, efficient process for testing. And then we have the antigen test, which is not as sensitive. The antigen test is a little bit more sensitive when you utilize it early on in the virus. So once you know that you've been exposed, that's the best time to do the antigen test. We also have antigen tests. However, we utilize that more for procedures. There are also some companies that have acquired antigen tests. I think as we see more companies that are entering that space of developing antigen tests, we will have more access to it. I think that it's difficult to get access to it because there's reagent issues. You may have the machine, but you may not be able to get the reagent. And you also have to have a healthcare provider administer the test. So just having the test at your work site doesn't do you a lot of good unless you have somebody to administer it. So those are the two types. And then of course you have the antibody test, which is not used much to determine if someone should go back to work. It basically is just used to see if you've been exposed, but there's still a lot of work that needs to be done on that test. I don't think it's ready to be released completely.
So we have a question that came in about how many tests is Kelsey administering per day, and are the cases still slowing down in the Houston area? Or are we starting to see that uptick like New York and other places up north are seeing?
So Kelsey does testing at a variety of sites, and roughly, I believe it's like 40 to 50 patients a day that are being tested through the drive-through system. Of course, the positive rate hasn't been that high within our system, which is good. I would say the numbers in Houston, they're still elevated. They're above the 200 mark for what is not good for community exposure, but it's better than it was in September. So things are starting to go down, trend downward, but there's always a lag. So you can never say it's truly going down because there's still cases that haven't been counted. There's still people who have not been tested. So it's really difficult to get those accurate numbers.
So let's talk a little bit about workplace protection. We had a question that came in about PPE. In the ideal world, what is the proper type of PPE that employees should be wearing, let's say for an office environment?
So for office environment, only a mask, I think, is sufficient. In my office environment, everyone has a mask. It's the expectation. You wear it pretty much all the time. There's, if you're in a gathering, in terms of you're in a conference room and you're able to socially distance, you may be able to take it off if you feel comfortable, but that's not 100% safe. But it's, especially now they're saying that it's airborne and it can be spread greater than 6 feet. I would say it's better to keep the mask on no matter where you are, in a conference room. But of course, if you're in your own office and it's a single office, it's okay to take your mask off.
And the second part of that question that came in is, can you talk about workstation sanitization? So how often should workstations be cleaned? And is it good enough for an employee just to wipe it down with a Clorox wipe at the end of the day, or does something further need to be done?
I think Clorox is effective at cleaning workstations. It depends how many people are using that workstation. So if you have multiple people using it, it needs to be cleaned after the person uses it. And of course, I would do another wash beforehand, just because you don't want to kind of utilize dirty workstations after someone's used it. And that's a good question, because there's a lot of shared computers or shared chairs, areas. You want to make sure they're cleaned in between.
So another follow-up question to that was about shared areas. And meeting places such as conference rooms and whatnot are being sanitized regularly. We know they are at Kelsey. When I've been in the office, I've seen our janitorial staff do that, and they're doing a really great job at it. So we'll give a little shout out to them on this call. But besides sanitizing, should you be spacing out your meetings in conference rooms? So the question was specifically, if someone books a meeting before you, should you wait 30 minutes, 40 minutes, an hour before you use that room again, or does it not matter at all?
It should not matter. I think in the case of exam rooms, when you do an exam and you have patients, the practice is always to clean the room in between. I think that's a great standard. If you can wipe down the tables and the chairs, I think that is a good practice. I don't think there's a certain amount of time that you need to wait to utilize the room. I don't think there's any rule there. I think it's okay. You just don't want a lot of people in the room. So as long as you're keeping your numbers down in the room, I think that should be okay if you have back-to-back conferences with people.
So we have 2 more questions that came in, and then we're going to wrap up. The second to last question that came in is about COVID fatigue. As an employer, how can you help your employees combat COVID fatigue and limit the amount of information you're sending to them, but making sure they're receiving just what they need to know?
I would say be strategic in your communications with your employees. Doing reminders at strategic times. You have to implement some fun things into the workplace that kind of help. And I would say here at Kelsey, I found that in certain areas, they'll bring in something, they'll bring in a treat. There's a lady that brings in fruit. And it's nice to have that break and just even having just kind of brief conversations with people, of course, wearing your mask, you don't want to do it for too long. I think that helps instead of feeling so isolated. Because sometimes you can feel isolated, but just having a brief conversation with someone, over donuts or whatever, donuts not healthy, but over fruit, I think helps when your employer is able to do things like that. It just shows that you care. It kind of breaks up the monotony of the day. Doing maybe some fun activities that you can do, competitions. I would still recommend decorating your offices, whatever the theme is, for Halloween, Christmas. Doing some of those things are fun. I think that really does help.
And the second to last question that came in is related to industries. Are we seeing a difference in COVID between, blue collar and white collar industries?
I think so. I think blue collar environments, there's higher exposures, obviously, with the workers are higher, they're higher risk because they're interacting with the general public, often, and so it places them at higher risk. So if you're white collar, you have a little bit more leeway and flexibility to maybe work from home, or you may have your own office. So I think there is a difference there.
And the second part of that question was regarding benefits. So do you have any tips to give to employers to look at the benefits that they have under their plans related to COVID care?
I would recommend talking to your HR benefits person to look at what your benefits are for having to be off work if you have COVID. I don't think a 2-week period is sufficient. I know many companies have extended that 2-week period to a little bit more flexible, maybe 3 to 4 weeks of leave. So you could create like a COVID leave policy. So if you have COVID, that you're not just docking them for their vacation time because they're out with COVID. So I think definitely, developing something with your benefits team is, I think, is really important.
Awesome. Well, we're going to go ahead and wrap up today. We're hitting our 45-minute time limit with you, and we want to make sure that you have time to get back to everything you have to do at Kelsey for us. So thank you, Dr. Mansfield, and everyone who joined us for our first Business Health Connect webinar. We really appreciate all of you tuning in and the amazing questions that you submitted. If you have any other questions, please feel free to reach out to your contact at Kelsey or Dr. Mansfield. I know we have a huge team here to support all of our employers. And in addition to that, I know you can check out the benefits available to all of you at kelseycare.com. We have great health and wellness benefits. So definitely, if you haven't looked at our Kelsey Care website, please take a look at that as well. So thank you to everyone again who joined us, and we hope you will tune in for future Business Health Connect webinars that we have. So Dr. Mansfield, do you have any closing remarks before we head out for the day?
No, I just want to say thank you for attending, and please reach out to us if you have any questions.
Awesome. Thanks, everyone. Have a wonderful afternoon, and we hope this nice, cool weather that we're having in fall stays here for just a little bit more in Houston. So y'all have a great afternoon.
Thank you. Bye.